Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today we're going to talk about knee pain, specifically if you've got a ligament injury called an ACL, which is your anterior cruciate ligament. We want to just talk a little bit more about that and what to do if it happens to you. Stay tuned, it's right now. For a lot of people that suffer from knee pain caused by trauma, there can also be an underlying component of a ligament damage. Now, hopefully, it doesn't occur that way, but just oftentimes if you have a twist or if you have a violent extension of your leg where your knee kind of goes into hyperextension, that can crush, and not literally crush, but put a crushing force on your ACL. Now, what is your ACL? It's your anterior cruciate ligament. The anterior, the word anterior means in the front, so it's towards the front of the knee, and you can think of a ligament like a plastic bag versus a rubber band. We've talked about this in past videos where muscles are like rubber bands. Tendons and ligaments are like plastic bags. They'll only take so much deformation before they break, whereas a muscle will go back and forth. It contracts and relaxes, takes lots of force. So this anterior cruciate ligament, when a force comes that stretches that front ligament within the knee, and it lives deep within the knee, and it can cause one of three grades of cruciate ligament tears. Number one is a grade 1, and then a grade 2, and then a grade 3. A grade 1, there's some irritation to the ligament and some slight tearing, but it's not very big in the quantity of it. A grade 2 is a moderate tear in that ligament, and there's still some stability there, but we have to be very careful in how we rehab it. And a grade 3 tear is a complete tear, and that one is going to require orthopedic evaluation. Now, interestingly enough, anterior cruciates, depending on where you're at in your life, they're more or less likely to get a surgery right away. So if you have full function on what you do in your day, it just was a weird thing that happened. There are people that can run around with anterior cruciates that are torn. But on the other hand, if you're a jumper or if you're a high-level athlete or even a weekend warrior that likes to get out, especially moving in different directions, then you're going to want to get a repair on a grade 3 tear. So that's going to require a surgical procedure. But below grade 3, then a lot of times rehabilitation with exercises and strengthening the muscles around it, that becomes your go-to, your first step in rehab of any cruciate ligament or any knee ligament injury, really. You want to make sure that those muscles become very strong and very stable, as they are the first protector or guardian of the knee. Now, if you happen to get an ACL grade 1 or grade 2 tear, they may want to do some injections in the knee to try to get some of the swelling down and that kind of thing, but resting it, making sure that you're not taking a diet high in inflammation food so that you don't contribute to the inflammation, and giving it lots of rest and then good rehab is going to be a solid start. Now, these providers that work with knees and understand this, there's some specific tests that they do to see mechanically if your knee seems to be stable or not. And also, there's MRI tests that will be done as an imaging test to see how bad the tear is. So if you've had a knee, especially if you hear a pop in the knee is never a good thing after trauma. That could mean that there's any number of ligaments in the knee that have been ruptured. And so always good if you hear a pop, go get that checked out right away by the qualified providers. Again, whether it be your sports injuries docs, your chiropractors that work with extremities, your physical therapists, your orthopedists, all those folks are really used to dealing with those types of situations. So I hope our brief description of ACL injuries has been helpful for you. If so, please share it with someone, send it to them. And if you have questions about it, you can let me know. My email is jim@ramoslaw.com. And please always remember, not only your knees, but your health matters.